40 seconds. Knowing the symptoms or risk factors can help possibly save your life. Joining us now is Dr. Patrick Thompson, vascular surgeon with the Hartford Healthcare Heart and Vascular Institute at MidState Medical Center. Doctor, welcome.
Hi, Lisa. Thanks for having me.
Great to have you. So what exactly causes a stroke?
So a stroke is essentially a sudden loss of blood flow, or more importantly, oxygen to the brain. And majority of these cases is due to a blockage in a blood vessel, but around 10% are due to a bleed in the brain itself.
All right, so we know that the symptoms can be subtle for someone. They may even disregard them. What are the signs that could indicate a stroke?
Yeah, so with every second, more brain cells die. So it's really important to recognize the stroke symptoms. There's a mnemonic called Be Fast. So if you all of a sudden experience balance issues, eye issues, so a lot of people will describe a curtain coming down, a blackness in your eye. F is for facial asymmetry. A is for arm weakness or leg weakness or loss in sensation. S is for speech difficulty, and T is meaning time is critical.
All right, doctor, talk about when in time when a vascular surgeon gets involved in stroke care.
So for high-risk patients specifically who smoke, drink, have diabetes, high blood pressure, those patients are at risk for developing plaque in the blood vessels in their neck called the carotid arteries. And that plaque can embolize or break off and go into your brain and cause a stroke. So we are responsible for removing that plaque and reducing your risk of stroke.
All right, and tell us how you treat the narrowing of the arteries.
So historically, we'd make an incision in the side of your neck, and we'd open up the actual blood vessel, and we'd remove the plaque itself. But now, over the last couple of years, we've started making a really small little incision on the bottom of your neck and actually putting a stent directly into the artery. And it's really reduced the risk of stroke during the procedure, and is better for our high-risk patients.
All right, and there's something called door-to-balloon time in treating a stroke. What is that all about?
So, going back to how quickly we can get the vessel open. So, generally, the quicker you get the vessel open, the more brain cells are able to be saved. So, the quicker you get into a stroke center and get that catheter-based procedure to remove the plaque, or the embolism, the better you are.
All right, Dr. Patrick Thompson, vascular surgeon with MidState Medical Center. Thank you very much. Great information.
Thank you.
Thank you.